This is the reason why beta blockers should be avoided or either used cautiously in people with diabetes, because people with diabetes take anti-diabetic drugs, usually insulin and other oral hypoglycemic agents, example metformin, etc. And the most common ADR of anti-diabetic drugs is hypoglycemia, and hypoglycemia is very common and profound with insulin therapy, usually in type 1 diabetics and type 2 diabetes, people usually on oral hypoglycemic agents, or some people with uncontrolled diabetes may take both insulin as well as OHAs, oral hypoglycemic agents. And therefore, in case of hypoglycemia, our body usually, in order to correct it, as a compensatory mechanism, will increase sympathetic activity, and in that case the sympathetic activity will give warning signs as well as help reverse the hypoglycemia. And due to sympathetic activity, the beta 1 and beta 2 receptors are activated and tachycardia is observed, tremors are observed, and sweating in case of hypoglycemia is observed. Whereas if the patient is taking beta blockers simultaneously along with oral hypoglycemic agents or any anti-diabetic drug, the beta blockers will block the receptors beta 1 and beta 2. Therefore, these warning signs aren't observed. We can't detect hypoglycemia as well as gluconeogenesis, which is required to correct hypoglycemia. Gluconeogenesis, that is synthesis of glucose in order to normalize the hypoglycemia, in order to normalize the glucose levels in the blood, is being affected. Therefore, these three things aren't observed in people taking beta blockers along with anti-diabetic drugs. Therefore, the only sign we can see is profound sweating, and we may not be sure this sweating is usual or unusual, and there are high chances of getting into severe hypoglycemia, and the most common complication is coma or sudden fall, which may lead to severe trauma or injury, etc. Therefore, anti-diabetics and beta blockers using simultaneously need to be avoided or either require cautionary use, or choose an alternate, such as there are other antihypertensive agents, for example ACE inhibitors,